Hi there, I'm Jen Henderson, and I'm a clinical counselor with mental wellness and substance use services for the Yukon government. And today, I'm going to continue our discussion on anxiety, but the focus of today is going to be on CBT or cognitive behavioral therapy. And then we're going to move on into talking about behavioral ways to reduce our anxiety. So let's get started. So, cognitive behavioral therapy, or CBT, is a type of therapy that's been around for probably 40 some years at least. And it's one of the most effective proven therapies out there. Of course, it's not the only one. There are a lot more types of therapies that can be extremely helpful, but this is the one that I've had the most success with for anxiety. So, let's take a look at what it actually is. So you'll notice on the slide here, we have a picture of a triangle. And I like to represent CBT, as do others, in a triangle because it really models this connection or interplay between our emotions, our behavior, and our thoughts. So if you think about a triangle, of course, there's three sides and three angles, and they're all connected. And the important thing here is if you change any side of the triangle, it's still going to be a triangle, but the whole triangle will shift and it will be slightly different. And so we can use this model or metaphor to treat anxiety. So just to go over the different sides, of course, at the bottom, we have our emotions. That's how we feel, and that's often what brings people into counseling because they want to change how they feel. So if we're talking anxiety, usually people feel that their anxiety is too much, too intense, too frequent, and they want to lower that or they want to reduce it. Then on the other side, or on the right-hand side, we have behavior. So that's the B in CBT. And of course, our behavior is what we do. It's our actions. And then on the left-hand side, we have our thoughts. Thoughts are also known as cognitions. So that's the C in CBT. And of course, that's what we think. So these things are all interrelated. And like I said, if we make one small adjustment on any side, really, the whole triangle will shift. And the idea is that we will feel different. So if I'm feeling nervous about giving this talk, I might I might have some anxious, worried thoughts about getting it done, doing it right. Um, because of that, I might. So that was my thought. I might then have some behaviors that reflect those thoughts, like I might putting off getting this done, and then I'm going to feel anxious that it's not done, and so then I'll have thoughts like, I better get this done. And then I'll do the action. I'll make this video. And then when it's done, I'm going to feel relieved. Actually, when I'm done creating these videos for you, I will probably feel a little bit less anxious and relieved. So that's just a small example of how our emotions and our thoughts and our actions are all interrelated. Now, I should say that this triangle represents us and what's going on within us. So often people might not even be aware of, how we're feeling or what our thoughts are. They might notice our behaviors, but they don't see those other sides of the triangle often for some people. But I just want to highlight that, yeah, the triangle is within us, it's internal. And yet, often there's things that happen outside of ourselves that impact us or the triangle. So these are external things. So they're, upsetting events or situations For instance, if while I'm making this video, my computer crashes and dies and I've lost the work that I've done, that's going to affect me. That's not within my control necessarily, but it will affect my emotions. I'll probably be feeling a bit more distressed, a bit more worried. I might have some negative thoughts like, oh darn, I need to repeat this, I need to do it again, do I have time for that? um, and hopefully then when I get to it again and have a computer that's fixed, then I'll feel better again. So again, just another small example to show that a lot of things happen outside of us, in our environment, with other people, and they affect us. And only we are responsible for how we feel. So those things affect us, but we have some control, actually all the control over how we feel about that, what we think about it, and how we choose to behave because of it. Hopefully that makes sense. So that's a very basic introduction to CBT. So one thing I want you to consider is, if you were to change one of the sides of the triangle, I want you to think for a moment what side you would choose to change first. What would be the easiest side to change? Just think about that for a sec. So, one thing I forgot to mention actually is that most people, seek help or seek counseling because they want to change how they feel. So they want to change their emotions. That's the main thing that brings people to get help. And actually, I don't know of any way to change directly how I feel. I can't think of a way. Usually, when we think about changing how we feel, we usually think of doing something, some kind of action or behavior, or we do something with our thoughts. So maybe we try to challenge them or think why, we shouldn't feel a certain way. We do something different with our thoughts. And I guess perhaps those are the two sides that hopefully you're thinking about when you're thinking about making a change in this triangle. And that is, the only way that I know to change how you feel is by changing your behavior or changing your thoughts. And what most people find, if I said, can you just make a change for 5 minutes, what would be the easiest? Most people would choose behavior. It's easiest to do some kind of action for a few minutes than it is to change the way you think. So that's why this video is actually focused on behaviors, because that's where we usually like to start when we're looking at treating a problem like anxiety. We start with behavior. So I'm going to move in to the next slide, which is really good for any kind of emotional issue. So we're going to look at behavioral strategies to reduce emotional vulnerability. So any kind of emotions. If you do these things, they will help regulate or calm your emotions. So it's general, although we can gear it specifically to anxiety as well. So if you see on the left-hand side of this slide, you'll see the acronym Please Me. And really what this is about is focusing on ourself and our own self-care. This is what's super important in order to regulate our emotions and help us be more, more calm, more easily able to handle stuff. So when we look at the PL in Please Me, we have treat physical illness. And of course, that's extremely important. If we're feeling sick from some kind of acute illness, virus, we want to take care of ourselves. We want to rest. But we might also be talking about some kind of chronic condition or disease that we have. And we need to do whatever we can within our power to take care of ourselves. Because if we're not feeling well, if we're in pain, then that's going to affect our ability to handle emotions. So that's important. Um, Another thing, the E in Please Me stands for balance eating. And if you watched the previous video, hopefully you learned or remembered that when we're feeling anxious, and sometimes like really acutely anxious, that fight or flight response gets triggered in our body. And when that happens, we don't need to digest food. Digestion is not important when we're talking about survival in the moment. And so often, people with anxiety don't have an appetite, so it tends to get really slowed down, and so you end up going and going and going, and then your body realizes that you haven't had any food, and you can get exhausted. So it's really important to eat as healthy as you can within the means that you have, and to pay attention to how much sugar that's going into your body, how much salt that's going into your body, as well as how much caffeine. Caffeine is one of those drugs that people don't realize, that it can increase your anxiety. So if you're someone who drinks a lot of coffee, energy drinks, even tea and chocolate, pops, all those things have caffeine in it. And if you're feeling anxious and you're wondering why, you might have the amount of anxiety that you do, just take a look at your diet and see what's going into your body, because caffeine can increase your anxiety, and it doesn't take much to become dependent on it. So pay attention to that, and see if you can reduce your caffeine intake just a little bit, and see if you can balance your eating, because you need to eat regularly as best as you can, even if you don't feel hungry. And I should mention that even though it might be more common for people with anxiety not to eat as much or not to eat as regularly, the opposite can also be true. Sometimes when we're feeling really anxious or worried, some people have the habit just to eat because it's sort of a distraction. So pay attention to that as well, and try to pace it out a little bit. Okay. Let's talk for a moment about the A in Please Me, which is avoid mood altering drugs. And of course, what I'm talking about here is alcohol and, any non prescribed drug. So, yeah, take your pick. There's lots out there. And so, what we want to do here, avoiding is great, or even cutting down a little bit if you can consider that, because often what people end up doing is using alcohol or drugs to cope with the problem or to cope with the emotion instead of actually feeling it or facing the problem. So it's kind of a way to avoid the feelings and the problems, because they can be hard sometimes. So it makes sense. But if we tend to rely on these ways of coping long term, then we're not actually getting to the other stuff, like getting to facing the problem or feeling the emotion, which can actually be helpful in the long run if we can feel and if we can face problems. So it's sometimes just hard to do that if we're drinking or using drugs. So if that's a way for you to cope, just pay attention to that and just try to become more aware of when you're using, and see if you want to do anything about that. Yeah. So with sleep, the S in Please Me, what we find is that people with anxiety tend to have a lot of problems sleeping. So you'll have I can't fall asleep because my brain won't shut off, my body won't calm down. You'll have people waking up in the middle of the night, so the middle insomnia, and then the early insomnia, which is waking up early in the morning, earlier than what you want. And so what you really want to do with sleep, not that there's a magic fix for it, but the best recommendation is to try to stick to a schedule as much as you can, because then your body will get used to the routine. And then once you get to that certain time, whenever bedtime is, if you're in a routine, your body will start to know when it's time to go to bed. So, and then resultantly, you might get a better sleep. So try to stick to a routine. Try to make your bedroom calm as best as you can. Try to make it mostly only for sleep, so that your body knows, when I get into bed, it's time to calm down. And if you do find yourself waking up in the middle of the night, probably worrying about getting enough sleep usually makes the problem worse. So if you can, just try to calmly tell yourself you'll eventually go back to sleep. It'll be okay. Know that usually when people wake up, at most you're only awake for one sleep cycle, which is maybe an hour and a half or so. So you're eventually, if you allow your body to relax, you will fall back to sleep roughly within that hour and a half. If you need to get up, just try to do something calming, relaxing, nothing too stimulating. Glass of milk, some water, listen to music, something not too intense. And that might help. Again, no magic fix, but sometimes if we just change our behavior just a little bit, it will make a difference. I know sometimes people, it is the worrying thoughts that keep you up. And so if you maybe have a piece of paper and something to write on beside your bed, and if a thought comes to you in the middle of the night and you don't want to forget it, sometimes you can just write it down. And then at least, it's on paper and you don't have to try and remember it. Just a suggestion. So the E in please stands for exercise, and get exercise is what's really important. And, especially for anxiety, because if our body is triggered into that fight or flight response fairly regularly, we want to have a physical way to release all those stress hormones that get built up in our body. So exercise is one way to do that. So it can be very helpful for anxiety. And actually, it's one of the most effective, cheapest ways to reduce our anxiety and even improve our mood. So if we can, it doesn't have to be, you don't have to run a marathon. It can just be something small. Anything that you do that is more than what you're doing now is better than nothing. So if it's going for a 2-minute walk, that's better than no walk. So see what you can do in that area, but any amount of movement that you can do is going to make a difference. I know some people like to use apps for that to get them motivated, or certain trackers, or step counters. All of those things are ways that can help motivate you to get moving, because that's often the hardest part, is the get moving. And the motivation often doesn't come until you get moving. If we wait for it to come, sometimes it never does. So get moving, even if you don't feel like it, and your body and your mind will appreciate that. Yeah. So finally, the me in please me is medications. And obviously, for more detailed information, you're going to want to talk to your doctor about this, or if you have a psychiatrist, you're going to want to talk to them about it. But in general, there are medications that can help treat anxiety. And what I know of, there's basically 3 kinds of medications that can be helpful. The first kind, the most commonly prescribed kind, is antidepressants, which don't just treat depression, they treat anxiety too. And so those are commonly prescribed. They take a while to get working, but they can make a difference for people. And then, another type of medications that we have are the more calming, relaxing medications that are sort of tranquilizing, and they're the benzodiazepines, and they work very fast, so they can be really effective. But in the long term, we can tend to get dependent on them and need them to feel more calm and relaxed. So there's definitely a time and place for them. But if you learn some of the strategies that I'm going to talk about in this video, those can also help in the long term if you don't want to take benzodiazepines in the long term, in the long run. And finally, there's another class of medications that are alpha and beta blockers, and they're used for people with anxiety as well as trauma, and they tend to affect some of the physical symptoms in our body, and they can slow some of those things down so that we feel less anxiety, especially for people even with phobias, with a public speaking phobia, for instance. Those kind of medications can be helpful. So if you're interested more about medications, please talk to your doctor or psychiatrist about it. Yeah. Okay, so what I just spoke about was just some general tips that you want to consider if you want to be less emotionally vulnerable. But now what I'm going to do is move into some more specific behavioral things that we can do to reduce anxiety. Okay. So I want to talk about the behavior or action of diaphragmatic breathing. So this is an activity that we can do anywhere, anytime, and it can help calm our body. So it's about breathing into our diaphragm. So if you notice the picture on the slide of the body with that red image, that is actually our diaphragm, which is actually a huge muscle in our body that separates the upper sort of chest cavity from the abdominal cavity in our body. And that's really what supports our breathing. And often what happens is people with anxiety tend to breathe more up here, more in the chest. And we want to actually reverse that with some breathing exercises. And we want to breathe deeper into our belly or our abdomen near our diaphragm. And if we can do that, it actually calms the body. So what I want you to do right now, this will only take, a few seconds or so, but I want you to put, one hand on your upper body, in your chest area, and another hand I want you to put just above your belly button if you can, kind of under your ribs. Your diaphragm is just under your ribs, sort of above your belly button. And I just want you to kind of take a moment and just notice what your body is doing. Which hand is moving more? And like I said, people with anxiety, you tend to see more movement up here, which says you're breathing more in your chest, and we want to slow that down. So with this hands-on pose, what we want to try and do is see if we can breathe more into our belly and have that hand move more. So this is an activity that you can do anywhere really, and you don't necessarily have to put your hands in these spots. You can just sort of sit and breathe, and sometimes it helps to sort of lean back a little bit more to relax the belly. So if you're sitting in a chair, you might want to try that. And you want to see if you can breathe slow and deep into your abdomen. That'll help calm the body. So that's one tip that you can do. There's a lot of ways that you can do that, but in general, you want to see if you can slow down your breathing and make it deeper. So I'm going to move on to the next slide here, and I'm just going to show you another example of how you can breathe. And so with this one, it's called box breathing. Sometimes it's referred to square breathing because it looks like a square or a box. And this one is a little bit more guided. And what we want to do with this one is we want to imagine a square. So like the slide, we want to breathe in for the count of 4. And then we're going to hold for the count of 4. And then we're going to breathe out for the count of 4. And then we're going to hold. Okay, let's try that. So breathe in, 2, 3, 4, and hold. 2, 3, 4. Breathe out. 2, 3, 4, and hold. 2, 3, 4, and one more time. Hold. And hold. Okay. So that's box breathing. So if you struggle with anxiety, and specifically if you have panic attacks, these are good exercises to try. And what's important to know is we want to practice these kinds of exercises before the time or before the moment that we actually need them, because then we'll be prepared when we actually need them. So we kind of want to maybe compare these exercises to canoeing. If you were going on a major canoe trip down the river and you've never paddled before, that's going to be a problem. You know, you're gonna get down the water anyway. If you've never paddled before or been in a canoe, you know, the river's going to push you and move you along. Just like breathing, you're going to breathe anyway. But if you actually know a few strokes and know what you're doing, that's going to make the journey a whole lot better and safer too. So breathing is kind of like that as well. If you're able to practice some of these exercises when you really need them to calm down, you'll know what to do. You'll have practiced. So it'll work more effectively. So see if you can try the hands-on pose and the box breathing. And if you're interested in more, there are tons of apps out there. So just have a look. You type anything to do with breathing, and lots of different free apps will come up. And I think people just have to decide what the best one is for you. So these are just two to get you started. Okay. I'm going to move into another topic, but it is related, and it's called mindfulness. So this is a topic that I won't do justice to in a couple of minutes. Really, a lot more time needs to be devoted to it, and can be in other workshops and things. But I want to at least introduce what mindfulness is, in case you haven't heard of it. So, what mindfulness is when we intentionally pay attention to the present moment. And while we're doing this, we're calmly noticing and accepting our feelings or our thoughts or whatever we're feeling in our body. And while that's happening, we're not judging them and we're not holding on to it. And when we practice mindfulness, we're not doing it to avoid something or to distract ourselves from something, and we're not escaping from anything. It's actually something that we do intentionally to help us focus on the here and now. And what we know is that when we are able to focus on the here and now without any kind of judgment, we actually feel calmer. Generally, we feel happier. We're not worrying about things. We're not dwelling on the past or worrying about the future. We're just focused on the present moment. So, what mindfulness does is it can actually help us feel that we have a little bit more control as well. It kind of puts us in charge rather than, having anxiety control us, which is what it can feel like sometimes. So, there are lots of different ways that you can practice being mindful. You can really do it anywhere, anytime, and no one even has to know. So that's the beautiful thing about mindfulness is we can practice it often. So one example would be if we were to have a glass of water, we could even drink our glass of water mindfully. And what that would look like is we might look at the glass of water before we actually drink it. We might put our hand on the glass, notice what the temperature is like, what that feels like on our hand. We then might experience that motion of lifting the glass. And then when we take a sip or a gulp, we would notice that. And we would notice what that feels like in our mouth, what the sensation is like, what the taste is like, what the temperature is like. And then when we swallow, we would continue to experience that and notice what that feels like going down our throat. So even drinking a glass of water can be done mindfully. And when we put all of our attention on it, we're focused on this present moment, which can then, it can be kind of calming. We're not focusing on all those other things that tend to pull us. So that's one example. But in a moment, I want to share with you or guide you through a very brief mindful breathing exercise. And then if you find that you're interested or if I've captured your attention somehow, you probably want to go looking for more of these exercises. Again, there are lots of apps out there that can help guide you through a mindfulness exercise, but you can also learn to do it on your own. It doesn't necessarily take someone guiding you through it. Once you know exactly what to do, then you'll be able to do it on your own anywhere, anytime. So what I want to do then is just very briefly kind of show you what a mindfulness or a mindful breathing exercise would be. Okay, so if you're ready, it'll only take a few minutes and then we'll be winding down this video. So if you can, wherever you are, try to sit if you can. If you're in a chair or on your bed or wherever you are, probably a chair works best. So if you can just try and sit comfortably in that chair, and if you can try and put your feet flat on the ground, because that will help ground you with the earth. And if you can, close your eyes if you feel comfortable and just continue listening. Or if you can just, cast your gaze downwards a bit and just kind of soften your eyes. And next, if you can just sort of, roll your shoulders forward and then backwards, just to relax those muscles. Then if you can lean your head from side to side, trying almost to touch your ear to your shoulders. And then you want to just gently try to drop those shoulders and just let them kind of hang and relax. And just, if you can, just shift your attention to your breathing. Just kind of notice how your breath flows in and out of your body. And with this exercise, you don't have to make any effort to change your breathing in any way. You just notice how your body breathes, what it does naturally. Just notice that flow of your breath in and out. And probably what you'll find as you're breathing is that your mind tends to wander. And as it tends to wander to thoughts or plans or problems or even bodily sensations, as it will, because that's what the mind does, just notice where your mind went without judging it or without pushing it away or clinging to it or wishing it were different. And just try to refocus your mind and guide your attention back to your breath. Keep in mind that your breath is an anchor that you can return to over and over again when you become distracted by your thoughts. So just try to breathe in and out. So as the practice comes to an end, I want you to just slowly expand your attention beyond your breathing. Just try to notice your feet flat on the floor and your body against your chair and your clothing against your body. And open your eyes if you haven't already. And wiggle your fingers and your toes. Shrug your shoulders. Stretch your limbs. Just kind of notice what your body and mind are feeling. So that really was just a very short, simple, mindful exercise that gets easier with practice. And the trick really about these kinds of exercises is just to notice where your mind goes and just try and bring yourself back to your breathing if you can. Remember, your breathing is what grounds you, that's your anchor. So, hopefully, what you learned today is a little bit about CBT, if you hadn't ever heard of that before, and you learned how you can potentially reduce or change your anxiety using some actions or behaviors. So, some general ones that we talked about, some general tips about sleeping and eating and exercise, but more specifically, we got to breathing into our diaphragm, so slow, deep breaths, box breathing, and then mindfulness. So, these tips are some of the best ways to get started when we're thinking about treating anxiety. So I really hope that you give them a try. And if you're interested in learning more about what we can do with our thoughts, stay tuned for the next video because that's what that one will be all about. Okay, thank you very much.